People oftentimes come into the office and ask what is carpal tunnel syndrome. If you look at the wrist, there are 8 bones in the wrist. They're called carpal bones. There is a ligament on the palm side that makes a tunnel. And in that tunnel are the tendons that bend your fingers and a nerve. Carpal tunnel syndrome is a result of compression on that nerve. Symptoms of carpal tunnel typically are numbness and tingling in the hand. People can get pain in the wrist. The pain can go down into the hand or up into the shoulder. Sometimes they have weakness. They oftentimes have symptoms at night.
The typical causes can be overuse, such as we see in young people, welders, or people that basically just do repetitive activity with their wrist. Like I said, mechanics, welders, steel workers, people even who work in kitchens can develop it. Other causes, less common, would be a person with diabetes or thyroid disease. One can try to prevent carpal tunnel syndrome by using proper mechanics, such as sitting at a desk, having your wrist in a neutral position so it's not flexed one way or the other. Unfortunately, if you work in a factory or steel work or this or that, it may be hard to avoid. But certainly if you work in a factory where you do repetitive activities, they could alternate the job or rotate your job duties so you're not using the same maneuvers 8 hours a day, 5 days a week. That may help too. Initial treatments for carpal tunnel syndrome typically would consist of bracing of the wrist, either full-time or for sure at night. Also, one can use anti-inflammatory medications like Motrin or naproxen. There obviously are many others one can try.
Some people might recommend injections of the carpal tunnel. I think that my indications for an injection would be somebody that I think has carpal tunnel, that the EMG does not show carpal tunnel. I might inject them to see if the symptoms go away. The symptoms will return. That proves it's carpal tunnel, and then you can proceed with other treatments. I might do it for a temporary condition like pregnancy, to get them through the pregnancy. I might do it for a patient that doesn't have time to recover from the surgery.
Most insurance do cover the surgery, but often they require you to get a test called an EMG, nerve conduction study, which will test the nerves in your hand to make sure it is carpal tunnel syndrome. Once a patient has failed what we call conservative non-operative treatment, then the next step is surgery. The 2 most utilized methods, one would be an open carpal tunnel release, which is the gold standard and most commonly performed way to do it, in which we make a 3 centimeter incision over the palm of the hand, which is about a little over 2 inches, and through that small incision we can release the pressure on the nerve by releasing the ligamentous band. The other method is called endoscopic, where you make a small incision over the nerve. That is also has good results, but you have increased chance of cutting a nerve or artery. So the risks are higher with that method. At 6 months, both methods have the same functional results, so there's no difference at 6 months. It can be done outpatient. You're in and out within an hour. The surgery can be done under local anesthesia or local anesthesia with IV sedation, or in rare cases some patients want to go to sleep, but we don't do that too often because the surgery is short and sweet. After surgery, a person can use their fingers as much as they want to. Obviously, gripping or holding something tightly will be uncomfortable, but it won't damage anything. We remove the stitches at 2 weeks and then start what we call scar massage, trying to desensitize the incision, and we teach the patient some physical therapy exercises to do at home. Obviously, a person can receive formal physical therapy at a facility if they need more aggressive therapy. But usually a person recovers all their strength and the incision's well healed by 4 weeks.
I mean, I typically tell people they're going to feel clumsy for 4 weeks after surgery with zippers, snaps, buttons, writing, small things. Heavy laborers going back to work at a repetitive type job maybe 6 to 8 weeks after surgery.
Sometimes if a patient works in a factory or other large facility where they have occupational therapists, they can assist the patient returning to work or giving the patient different work duties that won't aggravate the recent surgery.
And most people after surgery don't need formal therapy. I think, as Dr. Vaziri said, you can do scar massage. Most of the time they can do their own motion exercises at home.
Also, if a patient doesn't recover well enough within 4 to 6 months, or if they have a recurrence after 5 or 10 years, typically you can repeat the EMG nerve conduction study to see if there's any changes, or
Sometimes if it's a cervical problem
Yeah.
rather than a
Yeah.
peripheral problem.
yeah.
It's not common for carpal tunnel to recur after a release. It can. Symptoms are essentially very similar to what they were before they had their first surgery. This day and age, if somebody thinks they have carpal tunnel syndrome or they're worried about it, most insurances don't require referrals anymore to the office. They can just call the office and set up an appointment.